we're sitting here 5 years from now, and thanks to your company, what are you looking back in 2024, amazed that from a healthcare perspective, women were X. What's changed, and what role has your company had in creating that change?
That's a great question. I think in 5 years we see more democratization of the healthcare for women. At what Mira is doing, we're trying to give women a at-home tool to understand their hormone level, and this has never done before. And we have already saw so much potential on helping women to improve their own health, manage their lifestyle, and also helping the OBGYN and the IVF clinic to reduce their cost and increase their outcome, improve their outcome. So we really believe we got to put more data into the consumer's hands so they can understand their health better. And this democratization of the health data is really helpful for women's health in the future.
Based on what you're doing today, if you could share one real outcome, short story or use case that is happening today and positively affecting the women that are using your product.
Yeah, sure. So yes, so we have many success stories. So we have more than 130,000 users, and we help them to get pregnant. 84% of them got pregnant within 6 months. So, and especially this including a lot of people with PCOS and irregular cycle. So one of the most moving story we had was there was a user, and she was close to 35 years old, and she was trying to for her second baby, and she came out from birth control, and her cycle was such a mess. And she was saying OBGYN and the OB said, well, this is like you're fine, your husband is fine, so you guys just have something called unexplained infertility. And this is super confusing for women and for their family because there's really nothing they could do, and it's just based on luck. You're gonna get pregnant today or not. It's just based on luck. There's no action. So she was still desperate trying, and she doesn't have any results. And at the time, she found Mira, and she's like, "Wow, this is gonna cost me a few $100s." And her husband is like, "Well, otherwise we're gonna go to IVF, so that's like a $30,000. Maybe just give a try, and regardless it's gonna work or not, just worth to give a try." And then she tried Mira, and then she found that she has a luteal phase deficiency, which means the progesterone doesn't really release properly after ovulation. That's actually a pretty common problem for women with a little bit older age, but you usually you don't feel that. You can't tell unless you test your hormone. And then she identified her ovulation, and then she tried for a baby whatsoever. But she already scheduled her IVF. So she went for the IVF session. And at the first ultrasound, she found that she has already pregnant with Mira's help. And she told me this because we had a webinar. So we host a lot of webinar, which is free for our users. Invite the doctor, invite the patients with the success story. And then she joined, and she was like a speaker. And she told me this live with like thousands, hundreds of people on the webinar as an audience. And then she said this totally changed her life because she's like she prevented this cycle of IVF, which is like a $30,000 out of pocket cost, and with a lot of uncertainty, emotional stress, and also absenteeism. Like if she has to go through IVF, she has to go to the lab to do the blood drawing, and which is really have to be taking a half day off and just to get that done. So yeah, so that was really, really touching for me because a lot of detail, and you can totally see the struggle, emotional like roller coaster, not mentioning about the financial burden a woman was trying to go through. And these kind of cases are so typical around me. People like 30, 35 years old, and they struggle with all this kind of thing. And this mirror as a tool really helps them to really see themselves, really understand their own data so they can take a proper action.
Well, what I'm going to ask you to do, because I think so much of success is around your team and your company and the humans involved in your company, and you folks are the leaders. So I want you to come up with just 3 words that define your team, what keeps people excited, how you're being sure that you get inclusion of different voices, and given the time, literally 3 words or 3 phrases that best describe what differentiates the humans in your company?
Yeah, so first one's open-mindedness. So we're still early stage in women's health. So there's a lot of uncertainty, a lot of things we need to learn. So we need to take the information feedback from, every different aspects. And the second one is keep learning. So there's always something new. There's always, next stage of the thing can be different from what we have done yesterday. So keep learning. And the last one is the pioneering. So be the pioneer, have that motivation, have that passion to really drive women's health to the next stage.